Gets a major grant that comes with the promise of improving health care for almost everyone.
It's a $12 million stimulus grant to build an electronic system to share medical records. News on 6 reporter Emery Bryan has that story new at 5.
Well, while many doctors keep their medical records on computers, they can't access records created outside their own office. That will change because the government picked Tulsa for a pilot project to make those connections and see if it improves health care. At Dr. Pat Daly's office, all the medical records are on paper, in file folders, stacked on shelves. It's the way he's always done it, and while he's sold on the value of going electronic, he's not ready to start.
So there are just so many good reasons to do it, but right now, cost is a factor, and certainly just time and learning how to do that and getting real good at it, so that doesn't slow you down too much.
The new pilot project in Tulsa aims to improve health care by replacing paper files with electronic files. Doctors and nurses will create the electronic records, which will then be shared among clinics, hospitals, and first responders.
Literally at the fingertips of the paramedics, they'll be able to look up information on the patient, be able to find out what kind of medications are on, what kind of allergies they have, who their physician is.
This group represents just about every healthcare provider in Tulsa. They've all agreed to create and share electronic medical records as long as the individual patients agree.
So they can give the physician access to that or not. And if they do not, then that information wouldn't be made available.
It really comes
Dr. David Kendrick pursued the project through the OU School of Community Medicine.
By having that data, we can provide high-quality care in a much faster time frame, which benefits, obviously, the patient.
The project will connect most of Tulsa's physicians, giving them access to records created in other offices.
Places where you present for care are able to pull your records and make sure that they take into account all the medications that you're on, the fact that you have allergies to peanuts or to random medications.
Well, the next step is to build the computer network to make those connections. Patients should start seeing changes at their doctor by this summer, starting with new consent forms to take part. Much more information about this is online, of course, at newson6.com. Emery Bryan, the News on 6.